Hey everyone, welcome to my channel The Tooth Doctor. Today we are going to talk about 8 changes of pulp. This is diagrammatic representation of tooth showing enamel, dentine and pulp. And today we are going to talk about what are the changes that occur in this area with age, that is dental pulp. So starting with the introduction, that what is dental pulp. As you people all know, pulp is soft mesenchymal connective tissue that occupies pulp cavity in the central part of tooth. Going towards our main topic, that is 8 changes of dental pulp. Pulp, like every other connective tissue, undergoes changes with time. These changes can be natural or may be result of injury, such as caries, trauma, or restorative dental procedures. Regardless of the cause, the changes that happen in the pulp with age are divided into two categories. First is morphological changes. When the pulp shows changes in appearance, these changes are called morphological changes. And the second type of change is physiological changes, when the pulp shows changes in function. So overall we can say that pulp changes that happens with age can be classified into two types. First is morphological changes and the second is physiological changes. Starting with morphological changes, what are the morphological changes that happen in pulp with the age? Number one change is continued deposition of intratubular dentine results in reduction of tubule diameter. Here is a diagram to explain this line. This is diagrammatic representation of, this is enamel, this is dentine, and there is pulp. These are odontoblast cell, these are odontoblastic tubules, and these are dentinal tubules. Odontoblastic processes, these are odontoblastic processes. Odontoblastic processes goes into dentinal tubules, and due to continued deposition by odontoblastic process of dentine results in reduction of tubule diameter, and this tubule becomes thin and thin and thin with age because of deposition of dentine continuously due with from this odontoblastic process. Eventually it may obliterate the dentinal tubule or it just narrows, it depends. Second change that happens in pulp is with age is the reduction in pulp volume due to increase in secondary dentine deposition. As with the time, odontoblastic cells deposit dentine, that is secondary dentine, they continuously deposit, and because of this deposition the pulp cavity becomes smaller and smaller and smaller with age, and that's why as a consequence pulp volume decrease and decrease and decrease with age. So production of secondary dentine causes a reduction in pulp volume. Due to this production of secondary dentine and decreased pulp volume, root canal appear very thin. As you can see there, root canal appear very thin on radiographs and sometimes totally obliterated. At this area, this is totally obliterated. It is not actually pulp stone. This is because of secondary dentine that gets deposited with age. So whenever one is talking about or seeing the radiographs, the person should also consider the patient's age, because there are age changes that happen in the pulp and that may be manifested on the radiograph. As you can see there, a narrow root canal, and there it is the totally obliterated root canal, and also the pulp volume also decreases with age because of continuous deposition of secondary dentine. Number third change that happens in pulp with age is decrease in the number of pulp cells. Cell density decreases to 50% by the age of 70. Like if you have 100 cells when you were born, your cell density will be 50 at the age of 70 because the decrease in the number of pulp cells that happens with age continuously. Number fourth change that happens in pulp with age is presence of dystrophic calcification and pulp stone. Whenever there is inflammation and infection, and pulp starts its repair process that may result in dystrophic calcification or pulp stone in the tooth, and these stones may hinder the restorative procedures or the endodontic procedures whenever one person is performing with the tooth that has dystrophic calcification and pulp stones. So these dystrophic calcification and pulp stones mostly happens with age and grows with time. So this is also considered as the age changes in the pulp, that is presence of dystrophic calcification and pulp stone. As there in radiograph you can see that in there there is dystrophic calcification and there is the pulp stone. Whenever an irritant enters the area and the pulp want to seal itself, it start calcification to block the path of entry of that inflammatory thing or that irritant. So this makes dystrophic calcification or can cause the happening of pulp stones. Number fifth change that happens in pulp with age is degeneration and loss of myelinated and unmyelinated axons. It's because when the pulp space becomes smaller and smaller um, due to the secondary dentine deposition, there is a chain that decreases the space for the nerve fibers. That as a result, there is degeneration and loss of myelinated and unmyelinated axons, and as a result, this results in decreased sensitivity because of less nerves that may be myelinated or unmyelinated, but because of less nerves there is decrease in sensitivity with age because of secondary dentine deposition. As a result, that cause degeneration and loss of myelinated and unmyelinated nerve, and as a result there is decrease in sensitivity. Number 6 physiological change is reduction in number of blood vessels displaying arteriosclerotic changes. It is because of calcification and secondary dentine deposition. There is less space, and as a result there is a reduction in number of blood vessels, and it may show arteriosclerotic changes because of less space in the pulp. Number 7 change that happens in pulp with age is earlier it was believed that collagen content increased with age, but recent studies have found that collagen stabilizes after completion of tooth formation. With age, collagen form bundle, making its presence more apparent. So collagen fiber doesn't increase in number, but it forms the bundle. With age, it forms the bundle that make them more prominent, and that's why people earlier thought that collagen content increases with age, but now it is confirmed that the content doesn't increase with age, it just forms the bundle that make it more apparent. Going towards the physiological changes that happen in the pulp with age is number 1 is decrease in dentine permeability, provided protective environment for the pulp. It has an advantage that decreased dentine permeability provide protected environment for the pulp, but decrease in dentine permeability is because of continued secondary dentin deposition, and that may be the calcifications or dystrophic calcification that may be the cause, but overall with age it results in decrease in dentin permeability that provides protective environment for the pulp. Number second physiological change in the pulp with age is that its possibility of reduced ability to pulp to react to irritant and repair itself. It's because with age there is secondary dentin deposition resulting in decreased blood vessels, and also there is atherosclerotic change in blood vessels with age that results in reduced ability of pulp to react to irritant because there are less defense cells as a result of less blood vessels. So this result in reduced ability of pulp to irritant and repair itself. At one side it forms a protective layer by decreasing permeability of tooth, but at the other side it also causes the reduced ability of pulp to react to the irritants and repair itself. So it's the two-way thing, but with age that happens, that it reduces the ability of pulp to react to irritants and repair itself. Don't forget to like, share, subscribe and comment. Thanks for watching and supporting.